Hi, welcome to my channel. Today's topic is colon cancer screening, and the reason for it is March is colon cancer month. We want to raise awareness about colon cancer. It's very common, and hopefully by you sharing this video or watching this and sharing the information in this video with your friends and family, we'll be able to prevent some colon cancers. So let's talk about colon cancer, who gets it and who should be actually having a screening test done. So 90% of colon cancers actually happen in people that are above the age of 50. Okay, that's the first fact. So everybody who's above the age of 50, whether you're a man or a woman, you need to be screened for colon cancer. And there are a few ways that you can actually get screened for colon cancer. But we'll talk about that later. Right now I just need you to understand that colon cancer is pretty common and that you need to have a screening test done if you're above the age of 50. So when do you stop screening for colon cancer? Around age 75, and that seems to be the consensus. So let's talk a little bit about who could get colon cancer. So one is age above 50. The second is if you're leading a lifestyle which is physically you're not very active, you have a desk job, then you're at risk for having colon cancer. If you don't exercise much, you're at risk for colon cancer. If you smoke or you drink alcohol, you're at risk for colon cancer. And then there are medical conditions that put you at risk for having colon cancer. A big category is inflammatory bowel disease. You must have heard of Crohn's disease or ulcerative colitis. Those two diseases actually do put you at increased risk, and you need to have periodic colon cancer screenings. The other thing is if you know a family member who's had a colorectal cancer, then that puts you at high risk for having colon cancer as well. There are other familial conditions such as familial adenomatosis polyposis. There's something called Lynch syndrome. If that runs in the family, then again you're at risk for having colon cancer. But broadly speaking, if you have a low fiber diet, or a diet that's high in fat, if you're physically inactive, you're overweight or obese, and you have a sedentary lifestyle, then that would put you at really high risk for having colon cancer. So one of the things that we want to do is actually prevent colon cancer, and the way you prevent it is by doing a test that actually picks up colon cancer in very early stages. We call them polyps. By the way, if you have a history of already having had polyps, then that also puts you at risk for having colon cancer. The risk factors for colon cancer, you are at risk for colon cancer if 1. Your age is more than 50 or less than 75. It doesn't mean people above 75 don't get cancers, but there's no role for screening, because by the time you're here and you got screened, it takes 10-15 years for you to develop colon cancer. So you should be okay. The second thing is having a sedentary or an inactive lifestyle. So sedentary lifestyle or physical inactivity. The third is if you smoke or you drink alcohol, or you have a diet that's very low in fiber, or a diet that's very high in fat. And there are certain medical conditions that put you at high risk. And these, broadly speaking, are inflammatory bowel disease, and there are two of them. One is called Crohn's disease, and the other one is called ulcerative colitis. And there are syndromes called familial adenomatosis polyposis, or also there's another one called Lynch syndrome. But more importantly, if you've had previous polyp, that puts you at high risk. And again, there are many kinds of polyps. Some don't and some do. But just remember, if you had a previous polyp, somebody needs to go back and screen you with a colonoscopy to make sure that you're not developing colon cancer. So how do you screen for colon cancer? There are a few ways that you can do it. One of them is you do stool samples on consecutive days, and then those cards that you have, you bring them to the doctor's office and they send it to a lab and they check for blood. And there are various ways that can be done. It can be done by detecting blood through direct testing, we call it stool guide. There's immunochemical tests, and then there's a DNA test as well. But by itself, it's not good enough. So you have to do that with periodic flexible sigmoidoscopy. The problem that I find with this kind of testing, it has too many variables that you cannot control for. So for example, you can't really test a patient's stool without him or her having followed a certain diet. So 2 days before you start doing the stool test, you should really not consume any red meat or rare meat. There's a list of vegetables that you shouldn't have consumed, such as horseradish, cantaloupes, raw turnips, cauliflowers, red radishes, parsnips. The list is endless. Also, if you consume vitamin C, you consume multivitamin tablets, you have to be off of them. If you consume aspirin, Motrin, naproxen, it's going to really alter the results in the stool test. So you can easily see that doing a stool test is very cumbersome, it's impractical, and then by itself you can't just hang your head on the stool test. It still has to be combined with what's called a flexible sigmoidoscopy. So what a flexible sigmoidoscopy is, it's a shorter version of a colonoscope, and it doesn't go all the way around and check your entire colon. The reason that that's considered okay is because when the flexible sigmoidoscope is combined with the serial stool testing, the results are pretty similar to doing a full colonoscopy. Now, having said that, if you give your patient, or if as a patient you go and get your stool testing done and you test positive for blood, you will need a full colonoscopy. Also, if in the limited small sigmoidoscopy that you got done, you find something, you'll need a full colonoscopy. So those are the limitations of going that route, which is personally, I don't think, and this is just my opinion, I think it's very impractical for me to be in the room with the patient and really have him watch a certain diet, take this, eat this, and don't eat that, and then you do the stool test, and then you have to bring the card a certain way, and it has to ship to the lab in a certain period of time, and then it has to be rehydrated, and then still the test has flaws. So I actually tell my patients, just get a full colonoscopy done, because there are a few things that you can do with the colonoscopy. You can see the lesion, you can snare it, which is take it out, or you can biopsy it. So if the colonoscopy is not just screening, it's also diagnostic, and if it's clean, you're good for 10 years. So personally speaking, I highly recommend the person to go for colonoscopy. I will give them the options of doing a fecal occult blood test, which is called FOBT, with the flex rate. But most of my patients actually would agree with me that it's better to do a colonoscopy. Once again, I would really love for you to share this video with your loved ones, and also think about the people that you know who are above the age of 50, whether they're men or women, and who actually fit the profile of having being at high risk of colon cancer. Again, if you have any questions, feel free to post them, ask them, and I'd love for you to subscribe to videos like this. There will be more of them coming up. Please do like us on Facebook, and I would love to hear your comments. So thank you so much, and again, please do subscribe to our videos at DocTalksOnline, and we'll see you next time.